So, Anne, thank you so much for joining me
My
here.
pleasure.
We are at the HIMSS Global Conference.
Hmm.
It's the pre-conference day, so
Yep.
this whole exhibition space is still being prepared.
Yes.
However, there's been a lot going on today.
Hmm.
There was the Global Leaders Exchange, where you talked about the
Hmm.
data that HIMSS has
Hmm.
about the global landscape
Hmm.
when it comes to readiness for AI. So, can you share with me what you shared with the audience at the Global Leaders Exchange?
Yeah, absolutely. So HIMSS is one of the only, at least the only one I can find, global network that is objectively measuring the four dimensions of digital health transformation. And those four dimensions are deeply embedded in the scientific literature, the peer reviewed publications. The four are governance and workforce. We see those quite closely integrated. Interoperability. To what degree does data move and flow isn't accessible? I'm a nurse by training. If I don't have access to a patient's data in front of me as I'm working with them and providing care, I'm not making data driven decisions. The third one is analytics. To what degree do systems translate data into knowledge and insights? So, as a nurse, I don't want to see a file with 65 entries of data points that takes too long and really, quite frankly, you can't analyze on the spot. I need analytics that says this patient's blood pressure is up 46% from the last 7 visits, and that is putting that patient at risk or stroke or anything else. So, analytics is pretty important. And the last one's person enabled. To what degree does digital tools enable and support and connect to patients and families? Many patients around the world have chronic conditions: heart disease, diabetes, lung conditions like asthma or COPD. How many and how often do health systems offer to patients the digital tools to track their care, set their personal health goals? Patients who have terrible blood pressure problems. I want to dance at my daughter's wedding. How do I get there? So those are the four dimensions. What we measure is to what degree have health systems achieved each of those on a 100-point scale. So it's like, having a test at school. Did you get 80%? Did you get 95? Because you're really good. And the answer is, when we look across the global markets, Asia, Pacific countries, North America, Europe, Middle East, we're making progress. It's the good news. Statistically significant progress. But we're really just over halfway on those markers on governance, and a little under or at half for interoperability.
When you say we're making progress, what do you mean by that? And can you also talk a little bit about how the different continents
Yep.
compare?
Yep. So what I mean by that is we are measuring digital health indicators over time. So in 2021, we took all the global scores on those four dimensions, measured them, and compared them again when we measured again in 2023. We'll do it again for 25, 26. Compared time one, 2021, just after the pandemic, to 2023, we saw statistically significant improvement. So great, we're making progress. But where are we ahead, or where are we moving forward? Where are we not moving forward is what I shared this morning. We're making good progress in governance and workforce. We've made pretty good progress, around 58% on interoperability, very little progress on analytics, and very little progress on person enabled. So that tells me we've got these amazing AI technologies. If our governance is only about 60% towards that 100, and our interoperability means our data is only flowing in about half of the cases, how ready are we for AI? AI is fueled by data, and it has to be accurate data, and it has to be data that represents that population that you're caring for. We're not quite there. So we have great promise on AI. We haven't seen those promises materialize because I'm not sure we have the foundations for digital transformation that AI will rely on to be effective quite far enough. Now, one of your questions is, do the regions look differently? Yes, they do. Asia Pacific countries have different infrastructure, different data infrastructure. They tend to have electronic medical record systems they've designed themselves. Rather than compared to North America, we tend to have commercial available suppliers that provide those technologies. We implement them and we achieve progress. So they're different in terms of how they go about advancing digital transformation, but there is no statistical difference in Europe, Middle East versus North America versus Asia Pacific in terms of their progress. All markets are making progress. Have we made enough progress in certain areas? Maybe not. Are we likely to? Hopefully.
Do you have any assumptions or predictions what the results are going to be when you do the next measurement? I know that's kind of ungrateful to make, but it is clear that, between or during the pandemic, the need for technology was
Yes.
really big, so the investments followed.
Yes.
That stopped a little bit if we look at the digital health investments after the pandemic, and now we have this AI era where the VCs are increasingly investing in AI,
Yeah.
but it's still questionable what are the business models
Yeah.
for all the solutions that are being developed, and that's also what makes it hard for healthcare providers to really invest in these solutions. So we're in quite a challenging time where pilots take a long time, and providers are also struggling with having ideas on how to assess so many solutions that are out there. So do you have any predictions
Yes,
or
it's
expectations?
such a good question.
It's an ungrateful one, I know, because like if you get it wrong, then
Well, you can always project. Who knows what the future brings, right? What we're seeing, particularly in Europe, which is unlike any of the other markets, is entire countries measuring their digital maturity for entire countries. What that seems to be achieving is when they measure like MRAM maturity for every hospital in the country of Germany, for example. Now that German government has very explicit details on which of those 1,600 hospitals have what kinds of digital maturity, so they have very targeted investments. So it's evidence informed, right? Data-driven decision making. We've seen that in multiple countries in Europe. Very impressive results. What time 1 to time 2, so year 1, measure again in year 2, incredible progress. They go from 38% achievement up to 52% in a matter of 18 months. So what's very impressive, and I predict will continue and maybe accelerate, is country level investments are going to progress and get behind the digital transformation agenda. And if that continues, and we've seen it, as I say, primarily in Europe, then other countries, Canada may find that would be a next logical step because they're very closely aligned to Europe. Asia Pacific countries will likely contemplate. So what will I predict that they will continue to improve. I think the other driver here, so number one, COVID did us a favor. They shone a very bright light on the digital capacity we need and we didn't have. Great. Countries have now figured that out. I think there's a lot of uncertainty right now. We have tremendous global geopolitical challenges that I don't think any of us would have predicted that a year ago at this meeting. So I think the uncertainty is another driver of making progress. So what I'm hearing and getting a lot of questions on is the concept of readiness. What digital transformation do we need to advance in terms of readiness to manage the many uncertainties that may come in future. So I think it's a very interesting time that I have not seen in the last 20 years in digital health transformation. That's accelerating. COVID accelerated, and learning some very difficult lessons for many countries from COVID was an accelerator. I think geopolitical uncertainty and the many challenges so many populations are experiencing, this readiness concept is perhaps, I'm projecting I suppose, perhaps another accelerator that may continue to drive significant investments and change. In terms of AI, the one very significant challenge with AI is it's changing more rapidly than any health system can figure out what it is and what it will be. So the investments in AI are significant, but if you invest in AI technologies today to achieve a specific goal, and now there's a whole new range of technologies 6 months from now, that's challenging, right? So with AI, the rapid evolution of those technologies and understanding where do they achieve value for first and foremost patients and the workforce, clinicians who are looking after those patients, is where health systems are having to do a lot of work. And making sure they have a very clear strategy. What do we need AI to achieve? What does success look like? And how are we going to know if we get there?
I want to return for a second to the benchmarking and the progress that you mentioned before. Can you help me understand a little bit better what role does HIMSS play in this progress? So we know that there was a progress because we measured it,
right?
But how do we know the progress wouldn't happen if we didn't measure, given that the countries had the intention to improve things?
Yeah, it's a good question. Health systems and healthcare as a business sector is data-driven, it's evidence-based. New drugs come on the market only after extensive clinical trials that tell clinicians, here's what this medication or therapy achieves, right? So evidence and outcomes and impact is built into the DNA of healthcare systems. Digital transformation has now, I think, progressed to a point where evidence of digital transformation is similarly embedded in the DNA of healthcare. It has to be. How are you going to make the business case to invest $1 million in this digital transformation strategy if you can't demonstrate here's what it'll achieve? So health systems are spending year over year. If you look at OECD data, Commonwealth Fund data, year over year, healthcare is costing more every year. The majority of health systems in the world are publicly funded. That means the tax dollars fund healthcare. Well, if healthcare is increasing its costs and our GDP and growth economically is not growing at the same rate, you can only take money out of your bank account so long before financially it becomes challenging. So I think we're at that inflection point where healthcare has to find new transformative ways to deliver care that keeps people well. Why wait for that heart disease to show up at age 45? We know today with epidemiology data, we know who's at greatest risk for that heart disease in their 20s. So it's really a transformational shift from a disease management system, wait till you get sick, we'll diagnose you and treat you and hope for the best, to a proactive health management system. We know who's at risk, let's prevent those risks, make sure they never happen. And that's where AI plays such an important role. It predicts risk. So leverage it to predict risk and keep people well. HIMSS mission and vision is making sure every human has the opportunity to achieve their full health potential. Health potential. It's not preventing diseases. Help people be well and healthy. That's the opportunity, in my opinion.
Absolutely, targeted prevention
Yes.
and also cost savings, because you
Yes.
just don't do a one size fits all prevention program.
Exactly.
You actually, when you were explaining, the whole need for healthcare systems or just institutions to create business cases,
Yeah.
which always need numbers. I had a discussion recently with a representative of the Jersey government,
Mm-hmm.
which did use also the HIMSS models to create a business
Yep.
case for their investment. They are, I think, low on the maturity level, on the digital maturity, but what they did was they basically use that to calculate, if we don't invest
Yes.
in
Yeah.
progress, this is how many more people we're going to have to employ,
Mm-hmm.
this is how many errors we currently have, and we're
Yep.
going to keep on having.
Yes.
So that's where data really can become
Yeah.
powerful, to drive progress in healthcare, in investment in healthcare, especially in public systems,
Yeah.
where you only have one bag of money and policymakers need very convincing arguments to know that they're going to put it in healthcare infrastructure instead of, I don't know, public transport.
No question. It's a system level approach. What are our strategic assets digitally? Where are the gaps? And that's an outstanding lens. So if we leave those gaps and we don't fill them, what will be the year over year costs of doing so? And for me, I'm a nurse. Putting patients and families through adverse events, errors, inability to get care when and how they need it changes people's lives. So you're right, the business case is critical, and I completely support it. But measure where you are today and measure regularly so you know, are you making progress to tomorrow?
Yeah.
And that's really what HIMSS models do.
It's an interesting question, the whole measuring progress. It's years ago, when I was still working as a journalist, I transitioned into audience development, where basically my job was to do analytics, to figure out like what are people reading and what we can do to increase readership and retention. And I remember that after a few months, when we didn't really see growth, my boss said, well, you know what, we don't know what would happen if we didn't do
Right.
all the things that we did, because we did invest, in
Yeah.
content reuse, etc. Which is an interesting question. Like the media industry specifically is on the decline, so
Yeah.
just to stay afloat, there's
Yes.
many things that you need to do. So that kind of reminds me on that as well. Yeah.
There's so much work to be done for our populations. They have many opportunities in the consumer space. Rings or smartwatches that do all these things. And that's fabulous technology, and many consumers do very well with it. The gap, though, is the disconnect between those consumer tools. The watch that says, oh, my heart rate's been high for 2 hours, or 2 days, or 2 weeks, whatever it is. It's the disconnect between that data point for that person and what their providers would do to help support, understand, what does that mean? Does it mean you've been a little more stressed lately, so your heart rates are running high, so let's help you with your stress? Or does it mean there is something functionally wrong from a cardiac perspective, and we need to diagnose and better understand that? So for consumers, we need a much more integrated system by which people have the digital tools to engage with their provider to help make sense of what they're experiencing and manage those risks. I told this story today at the Global Leaders meeting. I have a family member that just went through very significant surgery for breast cancer. They did the surgery on a day. They went in at 8 o'clock. She was home by 3 o'clock. She's managing 2 drains, a large dressing, her own pain medication. One of the drains blocked. She had terrible swelling. She had no digital connectivity to a provider to help her through that. She was essentially managing her own recovery. Why is that? We have the smartphones, the apps, the tools to connect our families to their provider teams to work alongside them and give them the information they need. This is not a problem. This is a problem. Here's what we can do to support them through their journey. That's where I think digital health transformation really can advance progress in connecting people meaningfully.
Yeah, I think the challenge there is what are the workflows and what's the capacity of healthcare providers. I'm a chronic patient and I had quite a lot of challenges last year, and I was shocked by how on my own I was in between visits.
Yeah.
And even though my specialist was basically the care manager, if I had a challenge between visits, they just referred me to my GP.
Right.
So there's a huge need for the improved workflows as well, and the capacity management, which is also something that AI has a huge potential to address with agents.
Yep. And that's where the potential for the capacity is. If I, as a patient, had that tool and it would predict and tell me, based on everything I'm reporting or seeing or sensing, this is a risk or it's not, that actually removes capacity, because the alternative is, I don't know if it's good or bad, I better go to the clinic or the emergency room or call my physician. So I think depending on how it's structured, patients need that digital connectivity, but they need it to help them help themselves. And where and how we can help patients help themselves with the support when they need it, and not just, okay, go to your nearest emergency room, call your general practitioner, I think will actually open up capacity and build health literacy. If you have the tools to know what you're at risk for, you're far more likely to manage those risks than if you have no idea and you end up in a diagnostic nightmare because you just didn't know. So I think there's many opportunities. Is there a magic bullet? Not at all.
Absolutely.
Highly dependent on every person, every population. What it needs to look like for seniors is different than for children, different for young men versus young women. But that's the personalization opportunity. And I think the Agentic AI in particular could be very valuable if it's meaningfully connected to health systems in a way so it's not a you problem as a patient. It's a we problem, and we solve it together.
Yeah. Well, I'm glad that, despite the fact that we mentioned many problems, and there definitely are plenty in healthcare, we have ideas for improvement, and that's a really great place to be in. So thank you, Anne, for this short discussion, and I look forward to your further presentations and research.
Thank you so much. It is an absolute pleasure to have a chance to speak with you today.
Awesome. Thank you.
Done.
Done.
Done and done.
Done and done.